It's something we've heard from a number of health experts since the start of the pandemic. Face masks work in slowing the spread of COVID-19. But Virginia's top health official is now questioning how effective they are against the Omicron variant.
Acting Health Commissioner Dr. Colin Greene says masks should be optional in schools and said masks have, quote, potential adverse effects on children. Dana Smith has more.
With Omicron, the masking is much less effective than we've seen previously. And the benefit versus the risk is not as clear as it was before.
Virginia's acting health commissioner, Dr. Colin Greene, says face masks should be optional in schools. Greene acknowledged studies show face masks are effective, but given how transmissible Omicron is, the state's top health official is questioning how effective masks are now, though there isn't much research on this.
The wearing of the mask, while for short term is probably no big deal. If it's day after day after day, there are a number of studies showing adverse and potential adverse effects on emotion recognition, on level of happiness, essentially, interaction with children, not only who wear masks themselves, but who interact with adults who wear masks.
There are studies that say the opposite, that children can recognize emotions through face masks. Greene also pointed out some European countries do not require masks in schools, and Omicron causes milder illness than other COVID variants.
The risk of dying from COVID from a child is much, much less than the risk of a child dying in a motor vehicle accident in Virginia.
Greene's comments contradict CDC recommendations that say face masks are effective in slowing the spread of COVID, and everyone over the age of 2 should wear a mask inside schools. Though the CDC did concede, cloth masks don't offer as much protection as other masks.
I think the need for masks will go away before you get everybody to agree on whether they work or not. People are always going to disagree.
Dana Smith, 13 News Now.
Governor Youngkin appointed Dr. Greene as Virginia's acting state health commissioner when he took office.
And Dr. Greene agrees vaccinations are still our best bet at fighting the virus.